And while Congress spends hours asking Anthony Fauci whether Bill Gates had security clearance, the political movement that actually sabotaged America's pandemic response has escaped all accountability. Donald Trump was not some powerless observer during the pandemic. He was the President of the United States. So let's look at his real COVID record. He controlled the executive branch. He appointed the leadership of the Department of Health and Human Services. He had authority over the CDC, the FDA, and the Federal Emergency Response. He commanded an enormous communications apparatus. He could mobilize resources, coordinate governors, invoke emergency production powers, and provide the country with consistent leadership. Instead, Trump spent the most important weeks of the crisis lying about the severity of the threat. In recorded interviews with Bob Woodward, Trump acknowledged in early February 2020 that the virus was airborne, highly contagious and more deadly than the flu. Publicly, he repeatedly minimized this. He said the virus was under control. He predicted that cases would soon be close to zero. He said it might disappear like a miracle. He compared it to the seasonal flu. And in March, he admitted privately that he wanted to play it down. That was not a scientist revising an estimate as evidence changed. Trump understood that the virus was dangerous and deliberately told the public something else. The administration then presided over a catastrophic testing failure. The United States lost crucial weeks because the CDC's original test malfunctioned and federal regulations initially prevented qualified academics and private laboratories from quickly developing alternatives. Rather than taking responsibility, Trump insisted that anyone who wanted a test could get one, a statement that was just not true. Later, as testing expanded and case numbers rose, Trump complained that testing made the United States look bad. At a campaign rally, he said that he told officials to slow the testing down. The White House claimed he was joking. Trump then said that he did not kid. Trump also shamefully turned masks into a cultural war symbol. Trump announced the CDC's masking recommendations and immediately stressed that he did not intend to follow it. He mocked Joe Biden for wearing a mask. He held large maskless rallies. He attacked governors who maintained restrictions. His White House interfered with public health communications and pressured agencies to produce politically convenient guidance. This mattered because millions of Republican voters took their behavioral cues from him. A president wearing a mask would not have ended the pandemic, but it would have signaled that basic precautions were patriotic rather than cowardly. Instead, a piece of protective equipment became a declaration of political allegiance. Trump then repeatedly promoted unproven or dangerous treatments. He hyped hydroxychloroquine before there was any evidence that it worked, and of course it turned out that it didn't. He publicly speculated about bringing disinfectant or powerful light inside the body, while medical professionals sat beside him aghast. That alone should have been disqualifying. Trump also undermined the professionals working in his own government. When Fauci contradicted him, the White House circulated opposition research portraying Fauci as unreliable. Officials restricted Fauci's media appearances. Trump retweeted calls to fire him. He repeatedly suggested that expert warnings were exaggerated or politically motivated. The administration interfered with the CDC's scientific reports. Political appointees attempted to revise or delay public health publications they believed reflected poorly on Trump. Testing guidance was altered under political pressure, and Trump's communication officials accused government scientists of trying to undermine the president. And then, after vaccines were developed with significant support from Operation Warp Speed, one of the genuine achievements of Trump's administration, Trump refused to lead a serious national vaccination campaign. He received the vaccine privately. He did not allow himself to be photographed getting it. He rarely emphasized that his own administration had helped produce it. And after leaving office, he continued pandering to a political movement increasingly hostile to the vaccines his administration had accelerated. Anthony Fauci did not make Donald Trump do any of this. He did not force Trump to conceal the severity of the virus. He did not force Trump to mock masks. He did not force Trump to attack testing. He did not force Trump to promote medical nonsense. Anthony Fauci was an advisor. Donald Trump was the president. And we can see the consequences of that politicization in the data. The earliest wave of COVID devastated densely populated Democratic cities, particularly New York. There were several reasons for that. The virus arrived early in major international travel hubs. Officials did not understand how widely it was already spreading. New York was densely populated. Public transportation was crowded. Nursing homes were catastrophically vulnerable, and testing was almost non-existent. Democratic leaders made serious mistakes. New York's nursing home policy deserves particular condemnation. Officials were slow to recognize airborne transmission. Some Democratic politicians violated their own restrictions, and school closures lasted far too long in many Democratic jurisdictions. A balanced account of the pandemic should acknowledge all of that. But the political geography of the pandemic changed. Once vaccines became universally available to adults, Republican areas began experiencing substantially higher death rates. A peer-reviewed study linking voter registration and mortality records in Florida and Ohio found that the excess death rate amongst registered Republicans was approximately 15% higher than amongst registered Democrats during the study period. More importantly, the partisan gap widened dramatically after May 2021, when vaccines were widely available. Other studies found that the counties with greater support for Trump experienced higher COVID mortality, particularly after vaccines became available. It should be noted that Republican areas differ from Democratic areas in age, population density, income, health, and access to hospitals. Rural communities often have older populations and fewer medical resources. Researchers have attempted to adjust for those differences, but the vaccination gap is undeniable. Republican voters became less likely to get vaccinated. Conservative media spread medical misinformation, sometimes extreme. Republican governors and legislators competed to weaken public health recommendations. Politicians who had been vaccinated themselves presented vaccination as an assault on liberty. The results were measurable in human lives. When COVID first hit Democratic cities before vaccines existed, Republicans blamed Democratic governance. When COVID later killed people at a much higher rate in heavily Republican regions after vaccines became available, the same commentators suddenly discovered that public health was complicated. They blamed obesity, they blamed age, they blamed hospitals, they blamed ventilators, they blamed vaccines, and above all, they blamed the dastardly Anthony Fauci. The truth is that the Fauci obsession became a mechanism for avoiding the most politically uncomfortable fact of the pandemic, and that was the fact that Republican propaganda persuaded many of its own supporters to reject measures that could have kept them alive. This was not just an abstract policy disagreement. People died because they were told that COVID was exaggerated. They died because vaccination was portrayed as weakness. They died because masks became symbols of political affiliation. They died because conservative influencers convinced them that hospital doctors were part of a giant conspiracy. They died because Republican politicians were more afraid of being booed by their own voters than they were of telling those voters the truth. And the same politicians now want to put Anthony Fauci in prison.